So let's go over wound healing and surgery. This is the thing that's going to be on your CST exam, your first intention, second intention, third intention. It's common for students to find this overwhelming and not really understand it. So let me break it down. Your first intention, which is primary intention, that's when your wound edges are clean and surgically closed using sutures or staples. It allows the wound to heal directly and closing with minimal tissue loss. So it's going to be like a surgical incision, clean the laceration. It's going to give you a fast healing and a minimal scarring and a low infection rate. So think of it as like clean cut, closed shut. Your first intention is the way you want your wound to look and heal. Now your second intention healing is healing by granulation. I would remember that those two are the same because they may not ask you a question about second intention. They may just use the word granulation and you have to know that it's second intention. That's when a wound is left open and heals from the bottom up through granulation tissue, contraction, and epithelialization. Pressure ulcers, large open wounds, infected surgical wounds. It's a slower healing process and there's more scarring and a higher infection rate. You may have done this in your clinicals where you're doing like a polynoidal cyst and you've got a big open wound. You kind of have a wound that looks like this where it's left open and you're going to pack it full of iodoform. And then as that wound heals, it heals from the bottom up. So you get a healing from the bottom up to where it closes like this. So think of it as open, granulating, slow. Now your third intention is the delayed primary closure, when a wound is intentionally left open for a few days due to high risk of infection or contamination and is closed later on after the infection risk is reduced. So it's a dirty, contaminated abdominal wound. You're going to leave it open, give them some antibiotics, clean it up, wash it out, and then you'll come back later and you'll close it up. So you could have a lot with traumatic injuries when you have tissue loss or maybe like a gunshot wound and there's bowel spillage, something like that. But combines elements of both the first and second intention using trauma or dirty wounds. So you get moderate healing speed and a scar formation. The wound is clean and observed and then closed days later. So think of it as like waiting and watching and then closing after that. So first intention is the way you want, normal clean wound edges. Second intention is by granulation. Think of it as closing from the bottom up. So your third intention is left open usually for a few days because there's a high risk of infection and there's contamination in it. So you're going to want to get rid of the contamination or the infection before you close. You don't want to close up something that's infected. So then you're going to come back and close it later.